wrong? That's the big question today after a nurse here in the U.S. tested positive for the Ebola virus.
She had been caring for a patient who eventually died. Texas health officials are now monitoring 50 people who may have had contact with the nurse. A top federal health official says Ebola patients should only be sent to specialized containment hospitals. The World Health Organization labels this Ebola outbreak the most severe health emergency in modern times.
CBS 2's Hazel Sanchez has the very latest for us this noon. Hazel?
Chris and Mary hospital officials say the nurse was wearing full personal protective equipment while caring for the Ebola patient who died last week. The woman doesn't know how she became infected, but the Centers for Disease Control say there was a break in protocol and other caregivers could have been exposed. Hazmat crews spent hours cleaning the Dallas home of the Texas Health Presbyterian nurse who contracted the Ebola virus. The woman is the first to contract the disease in the United States. Her neighbors are nervous.
I mean, I'm definitely going to be taking more precautions. It's something that's it's scary, it's creepy that it's just a few houses down.
The Centers for Disease Control say the nurse had extensive contact with Ebola patient Thomas Duncan, who died Wednesday. 2 days later, the woman developed a fever and later tested positive for the potentially deadly disease.
This individual was following full CDC precautions, which are barrier and droplet. So gown, glove, mask, and shield.
There was a breach in protocol, and that breach in protocol resulted in this infection.
CDC Director Dr. Thomas Frieden suspects the nurse may have touched contaminated protective gear. Hospital officials are still trying to figure out when that lapse may have occurred and how many other people will need to be monitored 21 days for possible exposure. The CDC is now reevaluating protocols for using protective gear and limiting the number of healthcare workers who have contact with Ebola patients.
We are asking for that optimal protection.
A national nurses organization is demanding hospitals across the country provide healthcare workers with more hands-on training in handling Ebola patients.
And our hospitals, as you heard from the survey, are not providing the training that we need, nor are they providing the personal protection that we need to keep our patients, ourselves, our families, and our communities safe.
2 Boston hospitals were on high alert after treating a man who had traveled to Liberia and was suffering from head and muscle aches. But the Boston Public Health Commission says the man is not a high risk for Ebola. Now, that Texas nurse is in stable condition. Of the 6 Ebola patients treated in the U.S. before the nurse, Thomas Duncan was the only one not treated in one of 4 hospitals around the country with a specialized unit set up to deal with high-risk germs. The CDC's director says he is now considering moving all Ebola patients to those specialized hospitals to improve safety and minimize risk.